and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Mobley, and on today's episode, we have with us Dr. Megan Tuttle. She is with West Tennessee Medical Group, Paris, Pulmonary, and Primary Care. She is one of their primary care physicians. Welcome to the show, Megan.
Hi, thanks for having me.
So this is your first time on the show, and you're pretty new to the West Tennessee healthcare system.
Yeah.
However, not to medicine, though.
No.
So this has all been big news that West Tennessee Healthcare has partnered with Henry County and their medical center and all the clinics there as well. So I wanted to start off by having you give us a little bit of info about yourself and your journey into medicine.
Sure. So my name is Megan Tuttle. I originally am from Griffith, Indiana, which is a small town outside Chicago area. I did my undergrad at Indiana University. I knew I wanted to go into medicine pretty early in my life. I didn't really have like a real aha moment, but I always knew I wanted to be a doctor. So I majored in human biology, or pre-med, if you will. And then in undergrad, I went on a mission trip to Panama, actually. It really opened up my eyes to the beauty of medicine, the power of medicine.
Right.
After that, I took a year off and I scribed in the emergency room.
Okay.
So got to experience a lot of stuff there. It was a cool introduction to medicine. It's funny because they're like, leg swelling, that's heart failure. I'm like, how is leg swelling associated with your heart? So it was really awesome. It really exposed me to a lot of cool things. And then I got into Lincoln Memorial University for med school.
Okay.
So that is in East Tennessee. I spent 2 years in East Tennessee in the Cumberland Gap, Harrogate area, where the cows roam and the people don't. And I actually got my MBA also at Lincoln Memorial as well, and has healthcare administration.
Right. And I know you're a DO, so a lot of times when people look up doctors, they either see MD at the end, and even me, I've just now started noticing seeing DO at the end of someone's name. I know that might be confusing for some people who don't know that a DO is basically the same thing as an MD.
Yeah.
Tell us a little bit about that.
Yeah.
If there's any confusion within the communities.
Yeah. So I'm a doctor, just as any other doctors. DOs are doctors.
Right.
There's allopathic medicine and osteopathic medicine. DO is doctor of osteopathic medicine. MD is a doctor of allopathic medicine.
Okay.
So essentially we learn the same stuff. We do the same stuff. In med school, the DOs do an extra class of osteopathic medicine, which is manipulative medicine. It's learning to manipulate the body in such a way to heal illnesses or, osteopathic medicine can heal a lot of medical illnesses too.
Yeah, okay.
So it's learning how to manipulate the muscle fascia, the muscle, the skin into making you healthier.
So maybe like
added bonus.
I was going to say just like a little bit more hands-on.
Yeah. Just definitely added bonus.
Yeah, I guess for like any kind of sport injuries or things like that would be more along that track, I guess.
Yeah.
For that type of.
Yeah, I've seen a lot of magical things done with osteopathic medicine.
Okay.
It's a great thing that if you are dedicated to learning, it's a great extra tool to have in your tool belt. But a DO did the same education as an MD. We took the same test.
Right.
I did the same residency as MD, so doctor nonetheless.
Right. So what got you into pursuing a career in primary care? Because I know there's a lot of different places to go.
Yeah, so primary care was not actually on my spectrum at all going into medical school. Well, I guess residency, if you will. When I was a kid, you think of doctor as like, you're going to the doctor's office. Yeah. Having a relationship with your patients was so awesome.
Mm-hmm.
Medicine is an added bonus, to my tool belt. Making communication or making connections with people is what I really wanted to do. And so primary care was obviously, what you thought of as doctor. But then you go to med school and you learn all these different specialties that you can do. And, surgeon, OB, ENT, like you name it, you got it.
So many different ones.
Yeah. And then when I was in my 3rd and 4th year, I did some rotations with pulmonologist in Henry County, Dr. Carruth. And, I was steadfast at being a pulmonologist. That's what I wanted to be. And then I went to residency and that all changed. Residency is pretty grueling. But I just, fell in love with just being a generalist, not having to specialize. I always said, I would hate to lose all this knowledge, everything you've learned just to specialize. So being a primary care physician, I'm actually also a hospitalist as well. I do a week of hospice at Henry County too, a month. So I can do as much as or as little as I can. And that's what I love about primary care and hospice as well. But specifically primary care, I love making relationships with people.
Exactly, right.
Sitting in the office, talking to them first about how they are in life, how's it going? How's mom? How's dad? How's brother? How's son? And then it's like, okay, so let's talk about your blood pressure.
Getting to know the whole person.
Yeah, exactly.
So I know, tell me about where your office is located, because I know you mentioned pulmonology and...
Yeah, quite confusing.
So there's, you're in the pulmonology clinic.
Yes.
As a primary care specialist.
Yeah. So a lot of people are like, oh, you do both. No, I don't. Dr. Caruth was very generous in opening up his office. He's one of my mentors, and, he's a huge part of how I got to where I am today. And so he's like, hey, you want to, come down the hallway? Yeah. So that's, I am the primary care side of that office.
Right. If you want to call that number, it's 731-641-2765. And I'll also share the location as well. So I know you said you spent time in Henry County as a student. What was that experience like? And you kind of said, how did it shape your career, and how does it feel to be serving that community?
Yeah. I mean, being in Henry County, so I grew up outside of Chicago. I was pretty convinced I wanted to be a city girl again. I wanted to go back to Chicago. I wanted to live in the city, the
bustling city life.
Yeah. So I went to Paris, and there's no residence in Paris, which I think is a huge pro as a trainee, as a med student, because, I did go, my residency was at a huge academic center. So I had residents, I was the resident, there was attendings, and then there was med students. So here, you're right next to the attending. You're right there. You're doing everything. You are, interviewing patients. You're coming up with, your own plans, the best of your capabilities,
right.
of your little third year med school brain. And you are trying, and I think that just put me way ahead, in like the best way possible. So it was a huge career booster, going into residency for sure.
Right. And I know, Henry County, it's got a lot going on. Like, it's a rural city, but it's kind of growing, and it's got a lot going on.
Yes, it is.
So for where it is.
Yeah, more than when I was there about, 4 or 5 years ago.
So it is growing.
Yeah.
But you're still I guess people are still interested in that small town feel. It's still got that.
Yes, it's still very much a small town feel. It is. Being in Paris, at the end of it, I was like, okay, I guess I'm a country girl. I guess life is pointing me in that direction. And
I tried to leave Jackson, and I came back, and I was like, you know what, this is better.
Yeah.
Sometimes you have to,
I mean,
you don't know what you want until you get there. Yeah.
Yes, exactly. Now I, live in the country. I have no neighbors, and it's amazing.
It's great. Yeah. So in terms of primary care and preventative medicine, you kind of did talk a little bit about what primary care is and how it is an essential part of healthcare. If you want to talk a little bit more about that, and with preventative care being a big focus, what all does that include?
Yeah, of course. So primary care, I like to think of it as like your home base. Like, it's your home. I really encourage everyone to find a primary care doctor, no matter what your age is. Younger than 18 should be a pediatrician. Older than 18, be a primary care physician or a provider, if you will.
Right.
And you need that person. Preventative care, I guess, is primary care. It kind of goes hand in hand to me. Primary care, you do screenings. So mammograms, your colonoscopy. Everyone loves that colonoscopy.
Blood work.
Blood work.
Like that,
and then you find things. Well, we all pray we don't find anything.
Right.
But we find things, and primary care is the chance to catch it before it becomes a problem. That is preventative care.
Right.
That is finding something before it's a problem and finding a fix to it. And that's why it's so important. Primary care is so important, but it's so kind of swept under the radar, because everyone is like, I'm fine. Why do I need to go to the doctor?
You don't want to go years and years without ever seeing someone, and then finally finding out. Something that's been a long-term thing.
Yeah, unfortunately, that's every day in my career, but we make it work.
And especially if you only go to the doctor, like before I got a primary care, it would just be to go to the urgent care clinic, just any old urgent care, and it's just whoever's on call that day, and there's no one specific place of someone who has all of your information at the ready. So I know, with my chart here in the West Tennessee healthcare system, that works, if they have to go to the hospital and then they come to see you. Through my chart, everybody, they both talk to each other. So it's a good place to even have that app where everything is shared
Yeah,
within the
absolutely.
healthcare professionals at these different places. So how often should patients see a primary care provider?
Sure. That really depends who you are. It really does. If you're a healthy individual, maybe, yearly. I always, over the age of 50, I kind of recommend every 6 months.
Yeah.
That's when you're at just greater risk for disease, period. And then whenever you have a problem, whenever something's bothering
Yeah.
you, I think the biggest thing that in today's society is that you have to live with it. And that's not true.
Right.
If something's bothering you, whether it's physically or mentally, you talk to your primary care provider about it. Whether there's a fix or not, at least you're addressing that there is a problem first. That's the number one thing.
Yeah.
And trying to find.
And especially if you've established care with a primary care provider, you're not having to re-explain your whole story.
Exactly.
To
And that's
each new person.
and that's why you should always be plugged into a primary care provider. And
Right.
then if you ever need anything, you're plugged in because,
Right.
how many times do you call an office and it's like, the next open availability is a year
way
and a half
out, yeah.
away.
You're way out, yeah.
I hope you're not that sick.
Right.
But and then you're good. Then you go to urgent care and then the problem just repeats itself.
Right. Yeah. It's always good to have that at the ready and have a person. And especially if you go to urgent care, they'll ask you, like, do you have a primary care physician? And you can write someone's name down.
Exactly.
So at West Tennessee Healthcare, Henry County Hospital, it's prioritized through a patient-centered care. Kind of explain to us what that means in practical terms.
Yeah, I'm really big into patient-centered care. I like to talk about it a lot, actually. And we can probably talk for a whole hour on it, but I'll keep it to maybe 2 minutes. Patient-centered care is, it's care revolving around an individual. I think medicine for the longest time had a paternalistic view, right? You're coming to me, I'm telling you what to do, you do it. And that's not necessarily the case. I think patient-centered care is taking that individual and really, what is important to them. That's you come into my office, I'm asking you, what do you like to do? What's important to you? Because what's important to you is not important to the person sitting next to you or the person sitting across from you. Everyone has a different idea of what quality of life is to them.
Yeah,
yes.
Right.
So my job is to make you the healthiest version you can be while you live that quality of life.
Right.
I always like to give the example of my husband. If he, he was having some, clogged arteries or God forbid a heart attack later down and I said, steak, no more. He would be like, oh, no. and no. And
Let's figure out a way to keep steak in my life.
Yes, exactly. And it's like, okay, well, take your blood pressure, take your cholesterol medicine, get these other things in line, and you can still eat the steak. Maybe not every day, maybe not even every week, but maybe every other week. You know,
treat yourself, in a kind of way.
Exactly.
Yeah.
And so it's just everyone is different, and then the other person sitting next to you can be like, oh no, steak's gone, and that's like that's great. That's great. So it's just finding what that person wants, and it is, allowing them to carry out their quality of life, being the healthiest version they can be.
Right, exactly. And when it comes to tailoring care to meet an individual's unique needs, what role does communication and education play in empowering those patients to take control of their own health?
That's tough, especially in areas where education may not be
as readily available, I guess.
Right, exactly.
Or as you don't have as many options.
Exactly. So that's tough, and you try to do the best you can to explain the situation the best you can. You have to be good at communication. You have to be good at saying things in layman's terms in something that they understand, the patient understands.
Don't make people,
Yes, you can't overwhelm someone.
Right.
And you have to read the room. And it's,
know your audience.
Exactly. If you're like, this is, and all they're like, or they're on their phone, they ain't listening to you.
Yeah.
And so
I always try to bring someone with me because I'm always like, I
Yes.
get overwhelmed, like,
yes.
and especially when you get that app on my chart, like it'll have everything.
Exactly,
So you can like go back and reread it.
Exactly. And it's like, what does this mean? And it's like, monocytes present. This is low. What does that mean?
Yeah.
And it's like, it's probably fine, honestly. But you have to do the best you can in reiterating things, discussing again, or sometimes, the hardest is, breaking bad news, and you let them
Try to process it.
Yes. Yeah. You give them a few days and you do back. I always say, just call me. Yeah. I would much rather you call me at my office, I'm sorry if you get the voicemail, I'll call you back when I get it.
Right.
But I'd rather you call me and we can walk through it over the phone than you Google it. That's the worst thing you can do for yourself, is just get on that internet. So having an open line of communication is so important. Educating people and empowering them to make their own decisions is patient-centered care.
I always say, like with Googling, because I'm a Googler, is just hold it with an open hand. Like anything you read on Google, just let it wash over you, but don't internalize any
it's
of
our
that
nature.
stuff.
It's our nature. We Google everything all the time.
They're like, oh man, I think I have that. No,
we Google
it's like,
everything.
I'm going to look at this and I'm just going to, and what I like to do is ask my doctor and be like, this sounds stupid. And there's no stupid questions, but it's like, is this a thing?
Yeah.
Like, don't feel embarrassed to ask your doctor,
No.
hey, I Googled this thing. What does that mean?
And that goes back again to having a good relationship with the primary care physician.
Because
Having
Google is just the internet. Google doesn't know you personally, hasn't taken the time to get to know you.
Yes,
so it's like,
and you having that person that you can turn to, that's primary care. That is my job. That's what I want to do for my patients. I want them to feel empowered to take control of their own life.
And don't ever be embarrassed to ask questions, because I think that's a big thing. Your healthcare provider is here for you. So
exactly. And it's intimidating.
Any questions you have,
especially if I send you to a specialist, and you're like, "What did they just tell me?" Yeah. And then you just walk it through, because your specialists, they see how many patients a day they're just going through.
Yeah.
And
they went to school, so you don't have to.
Yeah.
As the patient.
Yeah.
So in Henry County, what makes it special to you, and how do you think it stands out in providing patient care?
Yeah, I love it. It's a small hospital trying to provide big care.
Mm-hmm.
And it's something that the community needs. And so we're thankful for, West Tennessee for helping us out and letting us still provide care to the community.
Sure.
The people there are so in need of healthcare needs. And it's just, it's amazing. It's amazing to be a part of something. I often, on the way home, it's like, wow, am I really doing this?
Yeah.
Rural care. But it's great. It's great. And I think that just having availability to people to really set them on the most healthy journey that they can have.
Right. Are there any common health concerns that you see in that community that are like more prevalent maybe?
I would say people that have never seen a primary care doctor and come in and with, they go to the hospital and find out they have a bunch of different things. So I think primary care, there are great primary care physicians there, but they get full fast. And so you have a bunch, you have people that don't have primary care physicians, and then they go to the hospital. Unfortunately, they find out that they have a lot of different things wrong with them that they never knew because they never saw anyone.
Right. So getting that message out there to have people go ahead and start being seen and getting established so that they can, be doing preventative care along the way. Do you have any hopes for the future of healthcare in Henry County, and how do you see your role in that?
Yeah, that's such a humbling question. I just want to do the best I can. Any physician just does the best they can.
Right.
We're human too, but being able to help one person. I'm naive to think I can change the world, right? That's
right.
Every little girl's dream. I want to change the world. But if I can help that person that I, just whether it's talking to them, whether it's educating them, whether it is, helping them through an illness, whether it's maybe helping them find options through a bad illness, because, we all get those, unfortunately. But it's just expanding my clinic and having the resources for people to really have full preventative care. There is a lot of things that, we don't have yet in that community that I'm hoping we can expand on later.
Yeah, hopefully. Exactly, yeah.
So we can provide the healthcare that the people deserve there.
Right, yeah. Hopefully it just keeps continuing to grow in positive ways. Do you have any advice that you would give to someone who is maybe considering a career in healthcare or primary care?
Don't give up.
Yeah.
Don't give up. Do it because you love to do it. Don't do it because someone's telling you to do it, or, I would do it because you want to do it and because you want to help people.
Yeah, especially I think with how long the schooling is and how difficult and, how big of an impact, it's really got to be something that that you're passionate about.
Oh, yeah. You unfortunately, I don't think people would make it through the training if they don't really
if it wasn't a passion.
Yeah. And it's just like always remember why you're doing it. I think it's not to get too down the line, but it's grueling. It's a grueling training, but you can't forget why you're there.
Right.
And you're there for the patient.
Right. If you could share one piece of advice on health and wellness to our listeners, do you have anything that you would tell them?
Come see me.
Yeah.
No, just really, I really hope that everyone finds the person that they feel comfortable with, whether that is a physician or a nurse practitioner or a physician's assistant. Find someone that you trust. Go get into their office, get plugged in. So when you go to the urgent care and they ask who your primary care provider is, you can write a name down.
Right.
Yeah. No, I mean, just take initiative in your own health.
And there's different people, different personalities. Like, if you find a primary care provider that you can get along, that's friendly with you. I mean, that's the best thing to do.
Yeah, find someone that you like and that that has your best interest in mind.
Right. So your location address, it's 300 Hospital Circle in Paris. And that phone number again is 731-641-2765 if any of our listeners want to call and set up an appointment with you.
Awesome.
Well, thank you so much for coming, and I hope you can come back. So what I want is hopefully that we can do maybe a series of things like if any of our providers that come on have something that they're especially passionate about, a topic or anything, absolutely we would love to have you back and hear some more from you. And so glad to talk to you and get to know you.
Awesome. Yeah.
Thank you so much.
Thanks.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.